I was really fortunate. I had 5 uncomplicated pregnancies, so I just got bigger and bigger and ate more and more.
When I was pregnant with twins, I didn't have any major physical issues. I kept my same energy, I kept my same work schedule, and I didn't have to change my operative glove size until my very last day.
Between my 3rd and 4th month, when I was operating, I started to spot. I paused for a minute and I broke scrub and I ran to the locker room. I call my OB. I've got this person on the table. And they said, "You need to come in right now." And I said, "Well, I can't. I've got a case that's going right now and I'm putting someone's finger back on." And so they said, "Well, when can you get here?" And I said, "When it's done." And so I replanted this young fella's finger and it did fantastic. And I went to the OB and then miscarried.
And I was lucky in that my pregnancies were relatively easy.
The second time I got pregnant, it was relatively uncomplicated. I basically made rounds at the hospital and left the hospital to go deliver my son. So it was all right.
In the spirit of efficiency, I operated in labor until I couldn't, and so that none of those days would be counted against my maternity leave, although I never did get credit for that day that I operated in labor. But
After they were born, with all the swelling and changes, I did develop carpal tunnel syndrome for a few weeks. I developed some pretty mild Bell's palsy for a couple weeks. That all resolved. And then I was back to work when the twins were 7 weeks old.
And I was given 6 weeks of break of postpartum baby time. And then when I went back, the chief resident that was making the schedule gave me back all of the calls that I had missed, just back to back. And that's when I was ready to quit.
Actually, there was no maternity policy at the time, so I used my vacation as my maternity leave.
We had a month of vacation each year, which was to be scheduled as a month. So when my second child was born, I had already had my vacation for my 5th year, and so I went back to work as a surgical chief resident when he was 2 weeks old.
The most common comment I got from the guys was, "Wow, you're probably going to get some extra vacation out of this." And I don't think any of them started vacation in labor.
I actually saw a patient the morning of my C-section and was back within 2 weeks.
When I went to tell my chairman that I was pregnant, it was just as I passed 3 months. And I made an appointment to go and talk to him, and I said, "I wanted to let you know that I'm pregnant." And his response was, "Well, you know, it's a great tragedy if a woman never becomes a mother, but now you know you'll never be an adequate surgeon."
There were several instances that I felt that the attendings and my fellow residents didn't really understand where I was coming from. One was when I went into preterm labor and had to be in L&D for about 6 to 8 hours, yet I never gave up my beeper. I continued to take calls while on a terbutaline drip.
You couldn't say, you know, I need 6 weeks or I need 3 months. And I don't remember if it was actually verbalized or not, but the intimation was, you know, don't come back. If you're going to do that, you're not going to be back.
And he said, "I hope I haven't offended you." And I said, "Well, I have to say that you're not my father and you're not my husband, so your opinion isn't really important to me." But had it been, that would have been an incredibly offensive statement.
When I went into labor, I was a little bit late to work that morning, and they put me in the OR to do the burn cases. And it was a nurse who sent me out saying, "You've been laboring." So when I was finally admitted to L&D, the attending at the time questioned why I was surrendering my beeper since it was my first child. I probably wouldn't have the baby till the next day. Perhaps I should just continue to hold my beeper until I actually had the baby.
And then he said, "Well, you know, you're entitled to maternity leave, but I just want you to know that if you take it, you won't be able to finish on time."
Unfortunately, I got pregnant again quickly after that. So, I mean, during that breastfeeding period.
I got pregnant again when my first child was 4 months old, and did the same thing.
And that was quite a shock for me. And I was really upset about it, primarily because I was worried how it was going to impact my job. And my first thought was I needed to have an abortion or my career was over. And I have a really good friend at that time who basically said, you need to sit down and talk to your program director and find out if your fears are the same as his fears. So I went in to talk to him, and I sat down and I was really emotional and said, I've got something really difficult to say, and burst into tears. So I said, there's no good way for me to tell you this. I'm pregnant again. And he burst out laughing. And he said, oh, I thought you were dying or something. He said, that's really good news. And then he said, oh my God, you can't be in my office. I've been smoking cigars. And he jumped up and ushered me out, and he said, you know, sometimes surprises are the best changes in your life.
It was a tough time emotionally to have to leave a brand new baby, my first child, at home.
And that was pretty difficult physically on me. He's fine, and I survived, but that was not easy.
So I think that a lot of people don't realize the pressures that are being placed on women who are trying to succeed in this male-dominated field.